Over the Labor Day weekend, the U.S. reached a total of 40 million COVID-19 infections since the coronavirus pandemic began. Last week, the country averaged more than 150,000 new cases, with over 12,000 new COVID patients hospitalized nationwide. U.S. hospitalizations have more than doubled since last Labor Day. The milestone comes as the Delta variant continues to spread after the long holiday weekend, and concerns grow over the Mu variant. Despite Dr. Anthony Fauci saying that it is not an immediate threat to the U.S., the new strain, first discovered in Colombia, may be vaccine resistant and has now been detected in every state except Nebraska. So for more on this, we want to bring in Dr. Soumi Eachempati. He is a co-founder, CEO, and CMO of Cleared4. Thank you so much for joining us, Doctor. So let us talk about this Mu variant. It's been found in 49 states. What could this mean for the country right now?
Sure. Well, as Dr. Fauci mentioned, as long as Delta is predominant, this is less of a concern. But the main thing we have to realize is that in certain areas, it's very prominent. Houston Methodist Hospital has already found 50 cases of it. The other thing we have to also realize is there probably are lots of pockets of the Mu variant out there that we're just not picking up. The United States has been very slacking to actually detect the genetic phenotyping of a lot of variants. And so Mu may be actually more prevalent than we think. It may even be in Nebraska, for example.
Oh, very interesting. So as COVID cases then surge across the country, the White House is pushing for those booster shots. But some experts warn that this push may be premature. What's your take on this?
Sure. Well, there's a couple things to think about. One is that the booster shot data is best in the Pfizer vaccine. We don't even know much about it in Moderna. The other thing that they're not really telling us a lot about is what is the composition of the vaccine? Is it really against the initial coronavirus, or is it can be made specifically for Delta? These are the kind of questions that we would really want to know. For example, if we knew that the vaccine booster was specifically designed for Delta variant and ready to go live today against the current strains, that would be a lot more meaningful to a lot of people and really probably put a dent in some of these increasing hospitalizations, but we don't know that information.
So let me ask you, we gave you sort of the long title that you have. Can you tell us about your organization, Cleared4, what it does, and how it contributes to monitoring cases of the coronavirus?
Sure. Thank you so much. So our Cleared4 is a software platform that organizations use, and it's designed for health and safety in the COVID-19 era. The platform originally started last year, way back when, with just a health survey and a contact tracing tool that organizations found very useful. But then since then, we added testing and vaccine verification modules. What this does is it makes the platform very flexible. For example, some colleges actually link a negative test and the presence of a vaccine to letting them get into the classroom. But other ones are less have different business rules and just want to go in with a health survey or the fact that they are vaccinated. So the important thing of the vaccine is its flexibility, and it can change regarding the status of COVID in their area and the individual business rules.
That's interesting. It sounds a little bit like something akin to a vaccine passport. It's as you know, everything related to COVID sparks controversy, and so there has been some controversy about the use of so-called vaccine passports, giving your sort of personal information or health information to a concert venue or a restaurant or a school. So would you put what you guys do into that category, call it a vaccine passport? And
Sure.
Kind of tell us a little bit more about what sort of organizations or entities use the technology.
Sure. Well, first I'll talk about vaccine passports because that's obviously very important, very timely, and invokes a lot of emotion. Somehow the phrase vaccine passport changed from a phrase of safety. Because what do we think about when we think about passports? We think about safe going into another country. Everyone would say you need a passport that's in good standing to go to another country. Nobody would argue that. But somehow the phrase vaccine passport has been changed to one from one of safety to one of loss of liberty. And I would actually argue the contrary. The people who have the proper rules for the organizations to get into the venue or the school or the organization actually have more liberty because they're free to interact free to interact with less worry that they will be likely to get COVID for themselves or their family at the venue. So I would want to put a different spin on it. You actually gain more liberty knowing that you are the freedom to probably be safe in that venue as if you didn't have the passport. Now, in terms of what organizations use this, everything, schools, or offices, businesses, venues. We were used at Madison Square Garden, film productions. It really can be used anywhere where people are concerned about trying to keep their people in the organization safe.
So, part of what we've been talking about a lot, too, over the last several weeks is this idea of breakthrough infections and, how significant are they? Are they really a concern? Do these vaccines work or not? The New York Times is reporting that a vaccinated person has a 1 in 5,000 chance of experiencing a breakthrough infection of COVID-19. In fact, in the article, it says, that's kind of like the bottom. It could be even harder to get it. But I think a lot of us have, if we don't know someone who had a breakthrough infection, we've certainly read about it in the paper, we've seen it on the news. Do we know how likely it is for someone to be infected? Okay, if the number is like 1 in 5,000, if you have been vaccinated, what's the likelihood of being infected if you have not been vaccinated? Because that's kind of the only way we can tell that 1 in 5,000 is actually a really good number.
Well, that's a complicated question, but the answer is it's most important to realize that this is not a homogeneous number. It's not 1 in 5,000 throughout the country. It's certainly less. And the New York Times article that brought up this number mentions that some of the states where they have higher vaccination rates, Massachusetts, for example, has lower chances of breakthrough infection. So when you ask what are the chances of getting the infection if you're not vaccinated, you just have to do the simple denominator. So about 330 million people in this country, about 53% are vaccinated. You get a number there, about 150 million or so, and then 150,000 cases a week. So it's just that number divided by that number. It's still a very low number, but in certain areas it's very high. And we know the hospitalization rates in some locales are on the verge of collapsing, and ICUs are full in at least several states. So it really is very regional.
So one of the other things that we sort of observed about this virus is clearly there's an ebb and flow. We've seen throughout the last year and a half or more, we've seen sort of peaks and then valleys and peaks and then valleys. Some health experts have suggested that there is a potential 2-month pattern of COVID surging and then falling. Is there any data that suggests that the pace of the pandemic that this is actually the pace of the pandemic as we're kind of like wrapping up the summer?
Sure. Well, that's a great point because and there's a lot of reasons that go into that 2-month ebb and flow. There's social reasons, for example, school finishing and people interacting with their families may, on one hand, give a little bit of contribution. Kids coming back from college to the virus numbers going up. And we also may see another jump as school gets back together. And then we also see a third variable of the different strains. And so right now, Delta is very transmissible and is still going fairly strong. And you already mentioned Mu. So there's a lot of things that go into that 2-3 month thing. But the other thing you have to keep in mind is if we can keep pushing vaccinations, that we will put a dent in the severity of these 2-month, 3-month type increases, because the more proportion of people that are vaccinated, the better.
So, yeah, we might still see sort of the peaks and valleys, but the peaks are going to get shorter and shorter.
That's right. That's right. Essentially,
Dr.
yeah.
Soumi
And so the
Eachempati,
150,000 you see won't be there.
That's what we want to hear. Those are the kind of numbers we want to hear. Dr. Soumi Eachempati, thank you so much.
Thank you so much, Amory.